the next global pandemic. It could be a virus we've never even heard of or an old foe that's back for round 2. But one thing's for sure, another major pandemic is only a matter of time. The question is, are we ready? We're taking a look at what could be our next big viral threat and what scientists are doing now to stop it before it starts. Avian influenza H5N1. Bird flu isn't exactly new. We've been dealing with avian influenza for decades. And while most strains don't affect people, there are fears that if the wrong virus mutates, the result could be catastrophic. Avian influenza. A viruses are categorized into different types based on which combinations of two proteins found on the virus's surface. These proteins are called hemagglutinin and neuraminidase. Each protein comes in many different forms, so we use a numbering system to keep track. The last pandemic strain was an H1N1 virus, meaning it had an H1 hemagglutinin protein and an N1 neuraminidase protein. But since then, a number of other strains have emerged. One is H5N1, commonly known as bird flu. It was first detected in 2003 in China and has caused sporadic outbreaks in poultry around the world ever since. Since 2016, the World Health Organization has reported more than 800 confirmed cases of H5N1 in humans, almost all of them in Asia. In February 2023, the United Nations Food and Agriculture Organization, or the FAO, declared that an outbreak of H5N1 in birds was the worst in history. As of late March 2023, over 58 million birds across 49 countries had been affected by the disease. The good news is that H5N1 doesn't seem to spread easily among people. Of the 800 cases reported by the WHO, only a little over half were thought to have come from direct contact with infected birds or surfaces contaminated by infected birds. The bad news is that this virus appears to be jumping species more frequently than in the past. Between October 2021 and February 2022, 15% of H5N1 cases in humans were linked to mammals such as cats, dogs, foxes, otters, and hedgehogs. And 2 recent studies suggest that the virus may be spreading more easily among birds than it did in the past, which may increase the chances of a mutation event that makes it transmissible in humans. If that happens, H5N1 could cause widespread illness and death. But experts say it's not likely to happen soon. Vaccines against H5N1 are already being developed just in case. Nipah virus. First identified in pigs in Malaysia in 1998, Nipah virus belongs to the same family of viruses as the one responsible for the 2003 SARS outbreak and the 2019-2020 COVID pandemic. Like those viruses, Nipah virus is a zoonotic virus, meaning it's transmitted from animals to people. And while it hasn't caused an epidemic yet, scientists worry that it could. Outbreaks have happened sporadically in Malaysia, Bangladesh, and India. Transmission seems to occur mainly through fruit bats. There were 4 large outbreaks of Nipah virus between 2004 and 2018, infecting 171 people, killing 115 of them. But Nipah virus is also thought to have caused smaller outbreaks that went unknown or were misdiagnosed. Many of the people infected during those outbreaks died. The mortality rate among those known to be infected ranged from 40 to 75%. Worse still, Nipah virus can be passed from person to person. During a 2003-2004 outbreak in Malaysia, 3 healthcare workers caring for patients with the disease caught it themselves. While it doesn't seem to spread easily from person to person, this means that if it were to infect someone who then went on to infect others, the result could be disastrous. Ebola and Marburg. Ebola and Marburg hemorrhagic fevers are caused by viruses that are very similar to each other and to the virus that causes SARS. Symptoms include fever, headache, joint pain, weakness, abdominal pain, diarrhea, vomiting, and bleeding. The Marburg virus was first discovered in 1967 in Marburg and Frankfurt, Germany, and in 1976 in Belgrade, Yugoslavia. Outbreaks of Marburg virus have occurred in Angola, the Democratic Republic of the Congo, Kenya, South Africa, and Uganda. The largest outbreak happened in Angola in 2004 to 2005 and killed at least 252 people. Ebola virus was discovered at the same time in Yambuku, Democratic Republic of the Congo, near the Ebola River. The first large outbreak happened in 1976 and killed up to 280 people. Since then, there have been 9 large outbreaks of Ebola in the Congo and 1 in Guinea. Overall, the mortality rate in these outbreaks has been around 50%. The biggest risk factor for severe illness and death seems to be being immunocompromised. Up until recently, there were no approved treatments for either illness. However, a vaccine against the Zaire Ebola virus, the deadliest of the 5 Ebola virus species, was licensed in 2019. The first rollout of this vaccine came in 2018 when thousands of people in Congo were vaccinated after an outbreak of Ebola in the country's northwest, although the outbreak ended without stopping the spread of the disease. Scientists believe that routine vaccination of people at high risk in areas where the disease occurs may be an effective way to curb transmission of both Ebola and Marburg viruses, SARS and MERS. Severe acute respiratory syndrome, or SARS, was a coronavirus that caused an outbreak of pneumonia in 2002. Middle East respiratory syndrome, or MERS, is caused by a different coronavirus that was identified in 2012. Both outbreaks were quickly brought under control, but not before causing hundreds of deaths. And coronaviruses continue to pose a threat to human health. While SARS and MERS haven't caused major outbreaks in recent years, genetic material from both viruses has been found circulating in bat populations. This suggests that the viruses could mutate and reemerge at any time. According to the WHO, as of late 2022, SARS-CoV had infected 8,098 people and killed 774 of them. MERS-CoV had infected 2,554 and killed 889. What's worse, there are worrying signs that SARS-CoV-2, the virus that caused the COVID-19 pandemic, may be becoming more deadly. The fact that SARS-CoV-2 is so closely related to the SARS-CoV and MERS-CoV viruses suggests that it could follow the same path. And while we know that coronaviruses are caused by bats, we don't know exactly how they get into humans. That means that another coronavirus could emerge at any time. Crimean Congo, Lassa, Rift Valley, and Zika. These 4 diseases might not sound familiar, but each is caused by a virus that has the potential to spark another global health crisis. Crimean Congo hemorrhagic fever is caused by a virus that's transmitted through ticks and has a mortality rate of around 30. The first human cases were identified in Crimea in 1944 and in Congo in 1969. Lassa fever is caused by the Lassa virus, which is transmitted by rats. Symptoms include fever, weakness, bleeding, shock, and organ failure. About 15 to 20% of people infected die. The first recognized outbreak of Lassa fever was in Nigeria in 1969. Rift Valley fever is caused by a virus that's transmitted by mosquitoes. Symptoms include fever, headache, muscle pain, joint pain, vomiting, diarrhea, and bleeding. About 1% of people infected die. The virus was first isolated in Kenya in 1931. Zika virus is transmitted through mosquito bites and is usually mild or asymptomatic. However, infection during pregnancy can cause birth defects. The virus was first identified in Uganda in 1947. Disease X. We'll let the World Health Organization explain this one. In December 2019, a novel coronavirus was identified as the cause of a severe pneumonia of unknown etiology in Wuhan, China. The identification of the etiologic agent was rapid, and the speed of the response by national and international authorities was commendable. However, this experience highlighted a worrying deficit. The name given to the virus, severe acute respiratory syndrome coronavirus 2, does not lend itself to casual conversation. Furthermore, it does not lend itself to easy communication to the general public. It was clear that a user-friendly name would be needed for use by the media and the general public. Thus, the WHO Director General proposed the name COVID-19, which stands for Coronavirus Disease 2019. In addition to the advantages mentioned above, the name COVID-19 fulfilled the criteria set out by the WHO guidelines for naming new viral diseases, leaving room for a potential second disease caused by another unknown pathogen to emerge in 2019. Hence, the working name Disease X was chosen. Emerging zoonotic viruses. There are thousands of viruses circulating in animal populations that could theoretically jump species and cause an epidemic. Scientists are constantly on the lookout for the next virus that could infect humans. For example, there are coronaviruses circulating in bats in China that have never infected people but could in the future. And there are viruses circulating in rodents in Africa that we have never even identified. Some of these viruses could cause illness similar to COVID-19. Others could cause respiratory, neurological, or hemorrhagic fevers. We just don't know. That's why scientists are studying animals and testing samples for new viruses. They're also developing better ways to identify viruses quickly and to develop vaccines and treatments against them. Antimicrobial resistance, or superbugs. We think of antibiotic resistance as a growing problem in hospitals, But it's a threat outside of hospitals too. Antibiotic resistance is when bacteria evolve to survive the drugs we use to kill them. This makes infections harder to treat and can lead to longer hospital stays, higher medical costs, and death. A study published in 2019 estimated that by 2050, antibiotic resistance could be responsible for more than 10 million deaths per year worldwide. The study also estimated that the global economy will suffer 100 trillion in losses due to reduced productivity caused by antibiotic resistance. But it's not just antibiotics that are becoming less effective. Fungicides, insecticides, herbicides, and disinfectants are also becoming less effective at killing harmful microbes. This means that everything from crop disease to parasitic worms to norovirus could cause bigger problems in the future. Luckily, scientists are working on ways to slow down antimicrobial resistance, such as developing new drugs and diagnostic tests and vaccines. Re-emerging respiratory viruses. The influenza virus is responsible for seasonal flu, which causes about 650,000 deaths every year. But flu viruses can mutate in unpredictable ways, which can allow them to evade the immune systems of people who have been vaccinated against previous versions of the virus. When this happens, the result can be a pandemic. For example, the Spanish flu of 1918 was caused by an H1N1 virus that mutated to become highly transmissible and deadly. The virus infected an estimated 500 million people and killed 50 to 100 million of them. Most of the deaths occurred in young, healthy adults, a group that's usually not hit hard by flu. Then there's the 2009 H1N1 pandemic, which infected more than 1 billion people and killed up to 575,000 of them. Both pandemics were caused by viruses that emerged after a relatively short period of time. This could happen again at any time. According to the WHO, the flu virus is responsible for between 290,000 and 650,000 deaths every year. That's why it's important to get a flu shot every year. But because flu viruses mutate so often, the vaccine has to be changed every year to match the virus that's circulating. And sometimes the match isn't perfect, which is why millions of people get sick with the flu even after getting vaccinated. Synthetic viruses or bioweapons. While scientists work to develop vaccines and treatments for existing viruses, some worry that they could accidentally create a virus that could cause a pandemic. In 2012, a group of researchers led by Yoshihiro Kawaoka of the University of Wisconsin created a bird flu virus in the lab that was transmissible in ferrets, a common model for flu viruses in animals. The team published their results in the journal Nature and noted that their findings highlight the risk of creating transmissible viruses by using non-mammalian cells for their research. But other scientists argue that this risk is low and that the benefits of creating viruses in the lab outweigh the risks. Still, accidents do happen. In 2014, a researcher at Erasmus Medical Center in Rotterdam, Netherlands, accidentally released a deadly H5N1 bird flu virus into a hallway outside her laboratory. No one got sick, but the incident raised concerns about safety in labs where dangerous viruses are studied. In 2017, scientists at Galveston National Laboratory in Texas accidentally sent live samples of the H5N1 virus to a CDC lab in Georgia instead of sending inactivated samples as they had intended. The CDC lab didn't realize they had received live virus samples until 13 days later. None of the employees at either lab became ill, but these incidents raise concerns about the risk of synthetic viruses escaping labs intentionally or accidentally. Stay tuned for more information on emerging infectious diseases. Based on public scientific sources, what do you think is the most likely next pandemic? Let us know your thoughts below. And thanks for watching.